Hey there, welcome to our channel. Have you ever wondered when the best time to enroll in Medicare is? Well, stick around because I've got information about Medicare enrollment that you won't want to miss. Now, in today's video, we're diving into the ultimate Medicare enrollment guide. Medicare is a federal health insurance program that provides essential medical coverage for millions of Americans, primarily those aged 65 and older. It also serves younger individuals with disabilities and certain medical conditions. Navigating the complexities of Medicare can be daunting, but understanding how to sign up is a crucial first step towards securing your health benefits. This guide aims to demystify the enrollment process, offering clear and concise instructions to ensure you can access the coverage you need without unnecessary stress or confusion. Signing up for Medicare involves several key steps, each with its own set of rules and timelines. Whether you're approaching your 65th birthday or are eligible due to a disability, knowing when and how to enroll can prevent costly penalties and gaps in coverage. The process can vary depending on your specific circumstances, such as whether you are automatically enrolled or need to sign up manually. Understanding Medicare. Medicare is a cornerstone of healthcare for millions of Americans, providing crucial coverage for hospital stays, medical services, and prescription drugs. It's divided into several parts, each serving a unique purpose. Part A, hospital insurance, covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Most people don't pay a premium for Part A if they or their spouse paid Medicare taxes while working. Part B, medical insurance, covers certain doctor's services, outpatient care, medical supplies, and preventive services. Part B requires a monthly premium, which is typically deducted from your Social Security benefits. Part C, Medicare Advantage, is an alternative to original Medicare. Part C plans are offered by private companies approved by Medicare. These plans provide all Part A and Part B services and may offer additional benefits like vision, dental, and prescription drug coverage. Part D, prescription drug coverage, helps cover the cost of prescription drugs available through Medicare-approved private insurers. Part D plans require a separate monthly premium. There are three main enrollment periods you need to be aware of: the initial enrollment period, the special enrollment period, and the general enrollment period. The initial enrollment period, or IEP, is the first opportunity for most people to sign up for Medicare. It begins 3 months before the month you turn 65, includes your birthday month, and extends 3 months after, giving you a 7-month window. Enrolling during this period ensures that your coverage starts as soon as you are eligible, avoiding any late enrollment penalties. Now, if you miss your IEP because you were covered by an employer's group health plan, you might qualify for a special enrollment period, or SEP. This period allows you to enroll in Medicare without penalties for up to 8 months after your employment ends or the group health coverage ends, whichever comes first. SEPs are also available for other qualifying life events such as moving to a new area or losing other insurance coverage. Finally, if you miss both your IEP and SEP, you can sign up during the General Enrollment Period, or GEP, which runs from January 1st to March 31st each year. Coverage will begin on July 1st of the same year, but you may face late enrollment penalties which can increase your premiums for Part B and Part D. Understanding these enrollment periods is essential to avoid unnecessary costs and ensure you have the healthcare coverage you need. Signing up for Medicare can be straightforward if you follow the correct steps and understand your options. Depending on your situation, you might be automatically enrolled, or you might need to sign up manually. Here's a detailed guide to help you through the process. If you're already receiving Social Security or Railroad Retirement Board benefits when you turn 65, you'll be automatically enrolled in Medicare Parts A and B. You'll receive your Medicare card 3 months before your 65th birthday. If you don't want Part B, follow the instructions on the card to decline it, as it comes with a monthly premium. If you're not automatically enrolled, you'll need to sign up manually. Here's how. First, you can sign up online. Visit the Social Security Administration website at ssa.gov. Create a My Social Security account if you don't already have one. Follow the prompts to apply for Medicare. The online application process is straightforward and typically takes about 10 to 30 minutes. Second, you can visit your local Social Security office in person. You may need to make an appointment. Bring necessary documents such as your birth certificate and Social Security card. Third, you can call Social Security at 1-800-772-1213. Representatives can help you with the application process and answer any questions you may have. If you qualify for a special enrollment period due to employment or other circumstances, contact the Social Security Administration to find out what documentation you'll need to provide and the steps to enroll. Once you've completed the enrollment process, you'll receive your Medicare card by mail. It's essential to review your coverage and understand your options, including whether you want to add a Medicare Advantage plan or Part C or a prescription drug plan or Part D. In the next section, we'll discuss how to choose the right Medicare plan for your needs. Selecting the right Medicare plan is crucial to ensure you receive the best possible coverage tailored to your needs. Medicare offers different plans, each with its own benefits and costs. Here's a breakdown of your options and guidance on how to choose the best plan for you. Original Medicare, which includes Parts A and B, covers hospital stays, doctor visits, preventive services, and certain home health services. While Part A is typically premium-free, Part B requires a monthly premium. You'll also have deductibles and co-insurance. However, Original Medicare does not cover most prescription drugs, vision, dental, or hearing care. Medicare Advantage, or Part C, plans are offered by private insurance companies approved by Medicare. These plans include all Part A and Part B benefits and often provide additional benefits like vision, dental, hearing, and prescription drug coverage. Each Medicare Advantage plan has different costs and rules, such as possible network restrictions. It's important to compare plans in your area to find one that fits your healthcare needs and budget. If you choose Original Medicare, you can add a standalone prescription drug plan, or Part D, to cover your medications. These plans are also offered by private insurers and vary in cost, and the list of covered drugs, known as the formulary. When selecting a Part D plan, consider your current medications, the plan's formulary, and any out-of-pocket costs. Medigap, or supplemental insurance policies, sold by private companies, help pay some of the out-of-pocket costs not covered by Original Medicare, such as co-payments, co-insurance, and deductibles. Medigap plans vary in coverage and cost, and you must have Original Medicare to purchase one. Note that Medigap policies do not include prescription drug coverage, so you may still need a Part D plan. Key considerations when choosing a plan include your healthcare needs, costs, provider networks, and additional benefits. By carefully evaluating these factors, you can choose a Medicare plan that best meets your healthcare needs and financial situation. Navigating Medicare can be complex, and several important considerations can significantly impact your coverage and costs. Understanding these factors will help you make informed decisions and avoid common pitfalls. Medicare involves various costs, including premiums, deductibles, co-payments, and co-insurance. While Part A is often premium-free, Part B requires a monthly premium, which can vary based on your income. Additionally, you'll need to pay a yearly deductible for Part B services, and there are out-of-pocket costs for services and supplies. Medicare Advantage, or Part C, and prescription drug plans, or Part D, also have their own premiums, deductibles, and co-payments, which can vary widely among plans. It's crucial to compare these costs across different plans to find one that fits your budget. Failing to sign up for Medicare when you're first eligible can result in significant penalties. If you don't enroll in Part B during your initial enrollment period and don't qualify for a special enrollment period, you could pay a late enrollment penalty for as long as you have Part B. This penalty is added to your monthly premium and increases the longer you delay enrollment. Similarly, if you delay enrolling in a Part D plan without having other creditable prescription drug coverage, you may also face a penalty. If you have other health insurance, such as from an employer or a retiree plan, it's essential to understand how Medicare will work with that coverage. For those with employer coverage, Medicare generally pays secondary if the employer has more than 20 employees, and primary if fewer. It's crucial to coordinate benefits to avoid paying unnecessary out-of-pocket costs and to ensure you're adequately covered. Medicare plans and your healthcare needs can change annually. During the Medicare open enrollment period from October 15th to December 7th, review your current coverage and any new plan options. This is an opportunity to switch plans, add or drop Part D coverage, or move between Original Medicare and Medicare Advantage to better suit your needs. For those with limited income and resources, programs like Medicaid, the Medicare Savings program, and extra help with Medicare prescription drug costs can provide financial assistance. Check eligibility criteria and apply if you qualify to reduce your healthcare costs significantly. By considering these factors, you can navigate the Medicare landscape more effectively, ensuring you have the coverage you need at a cost you can afford. Navigating the Medicare enrollment process can be challenging, but there are numerous resources and support services available to help you understand your options and make informed decisions. The official Medicare website and the Social Security Administration offer comprehensive information on enrollment, coverage options, costs, and benefits. These sites provide detailed guides, frequently asked questions, and tools to help you compare plans. For personalized assistance, you can contact Medicare at 1-800-MEDICARE or the Social Security Administration at 1-800-772-1213. State Health Insurance Assistance Programs, or SHIPs, offer free, unbiased counseling to help you understand your Medicare options. These programs are available in every state and provide one-on-one assistance with enrollment, plan comparisons, and understanding your rights and protections under Medicare. You can find your local SHIP by visiting shiptassenter.org or calling 1-877-839-2675. The Medicare Plan Finder tool on the Medicare website allows you to compare Medicare Advantage and Part D plans based on your specific needs and location. This tool provides detailed information on premiums, deductibles, covered medications, and provider networks, helping you make an informed decision. The Medigap Policy Finder tool on the Medicare website helps you compare Medigap plans available in your area. It provides information on coverage options, costs, and how to purchase a policy. Signing up for Medicare is a significant step toward securing your healthcare needs. Signing up for Medicare is a significant step toward securing your healthcare needs. While the process can seem daunting, understanding the basics of Medicare, knowing when to enroll, and making informed choices about your coverage can simplify the experience and help you avoid potential pitfalls. Taking the time to understand Medicare and carefully considering your options will pay off in the long run, providing you with peace of mind and the healthcare coverage you deserve. Before you go, don't forget to subscribe for more informative videos on healthcare. Share your Medicare enrollment experiences in the comments below, and check out another video in the playlist for additional tips on navigating the Medicare system. Thanks for watching, and I'll see you in the next one.